So, eGPlearners, I'm joined today by Ben. How are you doing there?
Good, thanks. Yep, nice to see you.
Cool. So, why don't you introduce yourself to the EGP learners? Because I don't think we've had you on the channel before.
So I am Dr. Ben Allen. I'm a GP in Sheffield, a GP partner, and so I do that for half my week, and the other half of my week is hard to describe. I might start calling it thought leadership, but it's a lot around learning, being curious, meeting people, visiting people, connecting on social media, asking questions, and then having a chance to maybe influence people in making decisions about general practice, or being able to support organizations to thrive, which is my kind of key interest.
Okay, that sounds really interesting. I think we may have to come back to that one to find out a bit more. But I guess one of the whole points of EPIC is trying to understand change in general practice and how clinicians or people have tried to drive that change through. So I guess tell us about what you did in practice in your area to try and help, I guess, the staff or the population, etc.
So I'm going to try and give you a very brief story of what happened over 5 or 6 years. Okay, so it was my practice. It was fairly low morale with the staff, fairly low patient satisfaction, and I didn't really know how to solve that. But what I got the sense of that there was things that were culturally driving that needed to be dealt with in the long term. I didn't know how to deal with that, so I then started mostly reading books, reading kind of people who are often involved in organizational development, organizational psychology. So people like Simon Sinek and Brené Brown and Patrick Lencioni, to name a few. And then listening to podcasts and YouTube, and then just drawing together a framework of the key things that would be the things that would all make a difference. And lots of them were a surprise to me. And then I just worked through that. And I think I could talk about maybe four main principles. So
Mm-hmm.
the first one would be team dynamics. So this comes from Patrick Lencioni's 5 dysfunctions of a team, and the bottom layer
Mm-hmm.
is psychological safety and trust. So to what extent do people in your organization feel free to speak up, be themselves, and just freely talk about what their fears are, what their ideas are, what their concerns are, such that once you've got them on the table, you're able to actually deal with them. And then when you've got that, then you're able to have conflict, debate, and make better decisions. So that was one.
Mm-hmm.
Second one was recruitment. I got the sense that recruitment was so key. The people are everything, aren't they? So but the people that you bring in is really, really key. And I sense that we were not spending the amount of time and thought that we ought to on that. So I learned from a recruitment specialist. I read a book on it, and then we had a huge turnover with reception, so I had lots of chance to practice. And I think we've learned some really great things about that. We've got a practice manager from retail who is absolutely brilliant, and it's just made a huge difference. But it was tough to land the investment in time initially with the partners, but now everyone says it was worth every minute. So that was my second one. The third one is around engaging with staff and with patients. So rather than just having the leaders who are the ones who've got the most power, who then just make all the decisions, and then other people maybe are you don't make very often make don't make very good decisions, or you don't take people with you. So it was around how do we take questions to the practice, so either the practice population or our staff, and how do we facilitate those conversations to be able to get all their thoughts about what the problems are, and then be able to agree on what the most important problems are, and then how do we then work out how to solve a particular problem, and how do we gravitate towards what we think is the best solution or two that we can all get behind. And that process, you don't have long in general practice, so might be half an hour
Mm-hmm.
that we that we have to be able to do that, but that's just such an important process, and you get better decisions, people feel more involved. And doing it with patients, that engagement has often been, in the past, it was often like a small group of patients at a PPG meeting. We've now got a Facebook group of 1,000 people, and I can put questions out there and I can respond to people, and we can engage, and that's another way of being able to take patients with you and hear their perspectives. And then the fourth thing I'd say is finding the right people to lead teams. So it's really important that we bring out the best in our staff. But to do that, you need to have a mechanism, and you need to have a person who is is responsible for a particular staff member to be able to get to know them, what they're interested in, what they're struggling with, what their strengths are, and where they want to get to in life. And so, but there's only so many people that you can do that for. So it might be that once you get to maybe eight people, so having somebody lead a team of 8 people, and it's their job to help bring out the best in their team members. But it's really important who that person is. So often the people who lead teams are people who have been around the longest, the most senior, but they're also often people who are quite certain and confident. And that doesn't always give you the best results. You need people who are really highly admired by people, who are really good at listening, who are compassionate, who are people trust. And those people don't necessarily think of themselves as leaders. And so it's a case of how do we find those people and how do we make sure that they're in roles where they can then bring out the best in people. So there's lots of other things, but I'd say they're the 4 main strands.
Okay, so there's lots of stuff in there. I guess if I was going to pick on one, that stuff you did with the reception team, with the kind of transformation and that kind of process, sounded like that reaped significant benefits to both your practice population and your staff and things. So you were talking about obviously all those things and really powerful stuff, but in particular that recruitment aspect you looked at with the practice reception team, how the benefits that had to your population, to your staff. You mentioned about going to a manager in retail. Just talk us a little bit more about that kind of process, because I think people would be keen to hear that.
Sure. Okay. So I think one of the first thing is being really clear on what you actually want. So and that, so I went to the reception team and said, what do you want out of a reception team member? You know, what are the attributes? What are the skills? And one of the things that came out the strongest was a team player. They wanted a team player. I didn't know what a team player actually what would be looking for in a team player. So then there was a book by Patrick Lencioni that unpacked the characteristics of a team player, and so and also how to spot one when you recruit. So and also we distilled down what mattered to us as an organization in terms of our values and what we wanted to achieve, and I think that was an important part of the process as well. And then so there was constructing the advert, I think, was part of it. So adverts for are just dead boring and uninspiring, and if you write the advert how you speak, it makes it far more engaging to read and far more interesting. And the way that I ended up doing it in the end was I was talking with our reception manager, saying, when you say that you want someone who is good at listening, tell me what you mean by that. And then I would write down the sentence that she said, and all these sentences then became the advert. So with adverts, don't just stick it on an NHS website. Make sure that you're thinking about where do good people go looking. Make sure that good people know good people. So make sure that you're passing the information to various people so that we're covering more channels. It's about finding the right person, not the person with the right skills. I mean, certainly with someone like a receptionist, understanding the IT and medical terminology, you can learn that, but being able to really be empathetic, compassionate, and good, and actually good on the phone as well. I think there are some of the things that are about who you are as a person. I was totally uninterested in people's qualifications for this role. It was we cast the net very wide, and we ended up with about 30, maybe I think we had 50 applications for a reception job.
Okay. Wow.
And I didn't want to weed many out based on qualifications. I didn't want to weed many people out. So we ended up, I think, with 30 phone call interviews, 15-minute phone calls. It took like 2 days. So it was me and a receptionist. Although now the receptionists are doing all of it. Now they're up and running. Yeah. So yeah, and then we ended up bringing in about 8 people. And so it was a long process, but my goodness, like that, what a difference it makes, because receptionists are so key to they filter all the incoming work, and they work really closely with a GP, and when they're you want them to use their common sense and their judgment, not necessarily with not with medical things, but you want them to bring all of that, not just be following protocols, and then you get a real richness. So that helps massively, but you need to then invest in that recruitment, and so many times when we do recruitment now, we end up with more people. We end up with more people who are brilliant than we can recruit, and we end up having to tell other practices like, do you want a receptionist? Do you want a manager? So we've often found people jobs. So that
Wow.
process has been really, really key.
And I guess with that process, was there a part of it that you thought, actually, in hindsight, we probably could have done something different that would have worked better? I guess something that you feel now, with retrospect, this could have been different.
One that's interesting, I think, is I think my reception team leader made better decisions about recruitment than I did.
Okay.
I think so. There's very for a couple of things. So I could think, well, I'm the most senior person. I've been to university. I'm a partner. I'm in charge. I'm very clever. I'm surely should be the one who makes the call if we're like not sure about it. I'm the one that's paying the wages. But actually, the team. So she's the reception team leader. She's going to be the one who ends up managing this person, and she's going to be more. She's more invested in getting the decision right, but also something about the fact that our reception team leader is from the community, and the people who we are and most of the people who are applying are from the community, and I think there's an element to which I think she was better able to get a sense for those people, whereas it might be that I might be a better judge on when we go recruiting a doctor. So I've since now, whenever in fact they've taken over the process, but as part of the process, when it was the two of us, if we were both not sure, I'd say you decide, because the times when I made the decision, it ended up not going so well.
I could definitely appreciate those kind of comments and stuff, and I think obviously we've got lots of different types of organizations in general practice, different sizes, different capacities and stuff, and I think when you are at that kind of size where you need individuals to help you make those decisions, going to the people who are going to be managing them absolutely is a sensible and appropriate place to go.
It's also about not overestimating the benefit of being clinically senior, being academically educated, because there are people who have got so much about them, yet often maybe on quite a low wage, or they're not been to university, but they are just as capable, if not more capable, of making difficult decisions than we are.
And how have you felt you've been able to foster that skill within the work that you're doing out of people? Have you been able to bring that out? So you mentioned about that concept of people being able to be more confident and capable of making the tougher decisions, particularly, I guess, with those admin-based roles, because clinicians often go back to clinical reasoning and all that kind of stuff. I guess in admin roles, that can be more challenging to take that responsibility, because there is that impetus to always, well, I'll check with my line manager, and absolutely that can be right and the appropriate thing to do. But how do you foster that increasing element of independence within the team? Is there anything you've specifically done to help with that?
It's a great question, and I think it's around what's the kind of support that you're giving people. And it's very easy when someone comes up to you with a question. It's very quick to give them the answer. Whereas I think coaching is where it's at. Basically, it's really around helping them to think it through, helping them to think, what are the resources that I can draw on? Where else can I get this question answered? Do you actually know the answer, but you're just wanting someone else to give the okay? And over time, when people realize that that you're never telling the answer, they always know it themselves, that they start to realize I don't need to ask. I don't need to ask. And I think one of the important lessons I've learned about all of this stuff, it comes into this, which is around the importance of long-term thinking. It's so hard when you're massively overwhelmed to do something that takes more time, that's about investing in the future. But it's just, in terms of the leadership, it's one of the most important aspects of leadership, I think, is those really grueling decisions where you're really overwhelmed, yet you take the time to do something properly that's about investing in the future. And the more times you do that, the long-term wins just stack up and stack up and stack up. But it's always really, really hard to do. But and that's an example, is helping people to think through the answers rather than giving them the answer. But I'm really keen to connect with anyone who is interested by what I've been talking about.
Awesome. So Ben, if people did want to hear more about your journey and what you've been up to and stuff, what's the best place for them to contact you through?
Yeah, so going through Twitter, so Ben Allen GP. I'm also on LinkedIn. I've been on quite a few podcasts where I've kind of unpacked the story of my practice and things as well. But I guess I'm hoping to get a website up and running just to make it easy to put things. But I'm sure I can redirect people if you come in through Twitter or LinkedIn. And my email is ben.allen1@nhs.net is another way to contact me.
Awesome. If people want those details, I'll put them down in the show notes below so you can access them easily and stuff and things. Thank you, Ben, for your time. It's been awesome
Great.
hearing about this journey you've been on and also how you've been trying to change things within your practice and the local area to try and help and navigate things. And I'm sure the eGP learners will probably be in contact to find out more and stuff in due time.
And I want to thank you because you put in so many hours and effort into connecting, into listening, into sharing and unpacking, and it's such a valuable thing that you do, and you spend your time. And I just, so many people admire you, and I just, thanks for all that you do for the general practice community.
Thank you. I always still feel weird about that. I still struggle to know what to say to that, but thank you. Appreciate it. And definitely hoping that this series will continue to help people as well. So hopefully hear from more of you as you want to join us on iPick. Thank you, Ben, for your time. Loved it. Awesome. And we will absolutely catch you in the next episode.